Welcome to the Stress Management and Emotional Wellness module for health coaches. So, is this an issue for my clients? Please pause for a moment and take the survey. Take note of your scores and come back to us. Were the results from your quiz surprising? Only about 17% of Americans are in optimal mental health. This means that there's a reasonable chance that your client has some of these issues they want to work on within their emotional health. Further, chronic stress specifically is associated with So what is stress? According to Medline Plus, stress is a feeling of emotional or physical tension. It can come from any event or a thought that makes you feel frustrated, angry, or nervous. Stress is your body's natural reaction to a challenge or a demand. As you saw in the short video, our bodies react to stress by releasing hormones that help us handle these intense situations. We get more alert, our muscles tense, and our blood pressure rises. But what happens when that stress is chronic? Those same symptoms that are helpful in a short-term situation can lead to negative health outcomes. So we see the difference between acute and chronic stress being that one is more negative and one is more positive. One can help you manage dangerous situations, and the other one is going to lead to more health problems. Coaches might encounter a chicken or egg situation when dealing with lifestyle changes and stress. We know that food, exercise, healthy relationships, etc. can help alleviate stress long term. However, the process of change might be frightening or stressful in itself. Our clients may feel stress related to lifestyle changes that we are helping them with. Issues around communication are a large component of this stress. For example, if I quit drinking, I will have to tell my friends that I drink with. Will they think that I'm trying to be better than them? Will I still have social support? Also, if I quit drinking, how will I deal with the everyday stress that work causes me? Take a moment to think about a lifestyle change that you or a client has made. Think about the ways that stress may have manifested in this change, then continue on to the next slide. As health coaches, we should be familiar with stress reduction and relaxation techniques. Reference the readings we provided to learn more. Sometimes we might need to specifically remind our clients that self-care and taking a break are okay. However, the coping techniques that we sometimes use, like social isolation or drugs and alcohol, should be avoided as they can lead to more stress long term. Some studies show that practicing meditation can help with our stress, pain, blood pressure, and some psychological disorders. Research isn't conclusive about the effects of meditation on certain disorders, but there is really great evidence that it can help with stress and insomnia. There have been rare reports about meditation worsening symptoms for some psychological disorders, so if your client wants to start meditation and has one of these, ask them to consult with their mental health professional. See your readings for more information about meditation specifically. So what are some limits for health coaching with emotional and mental wellness and stress? Well, most people deal with some level of stress. It is necessary to be aware that there are some levels that could be red flags. Many mental health issues require trained counselors, social workers, or psychiatrists. It is a health coach's ethical obligation to remember our scope of practice and refer when necessary. Locate mental health resources in your practice or community and build relationships in order to serve your clients. If you're wondering what your boundaries are, we're including the International Coach Federation's top 10 reasons to refer. According to the International Coach Federation, here are the top 10 reasons to refer. You should refer your client to a mental health professional if your client is exhibiting a decline in his or her ability to experience pleasure and/or has an increase in being sad, hopeless, and helpless, has intrusive thoughts or is unable to concentrate or focus, is unable to get sleep or awakens during the night and is unable to get back to sleep, or sleeps excessively, has a decrease in appetite or an increase in appetite, is feeling guilty because others have suffered or died, has feelings of despair or hopelessness, is being hyper alert and or excessively tired, has increased irritability or outbursts of anger, has impulsive and risk-taking behavior, and lastly, has thoughts of death and or suicide. The National Suicide Prevention Lifeline at 1-800-273-TALK is a really great resource for immediate help, whether that is you calling on behalf of someone else or someone calling for themselves. If you want to have a resource in your resource packet, this could be a really useful one. It also is useful if you are worried about a client and don't know how to handle a potential emergency situation. While we are not mental health professionals, there are a lot of ways we can help people suffering from mental illness. Like with anyone else, facilitating goal setting, being a resource if and when needed, and listening are incredibly helpful. There is stigma associated with mental health issues. This stigma might be a barrier to opening up about mental health experiences or to seeking professional care. This stigma can also keep people from acknowledging symptoms, they might avoid treatment, and they might avoid daily activities. According to a CDC study, many adults understand that treatment can help people lead normal lives. However, fewer people believe that others are going to be caring and sympathetic towards those with mental illness. This means that even if you're trying to help someone, they might assume that you are not going to be caring and sympathetic. If you suspect stigma might be a barrier for your client, it is important to remember that we can either contribute to stigma or help our clients deal with it. Since we want to be caring allies to our clients, we need to find ways to reduce the stigma and do our best to avoid contributing to it, especially if they feel that they are getting more stigmatized from their health care providers, their families, etc. One way that we can do this is to remember the coaching spirit. Remembering our coaching spirit can guide us in how we operate with our clients. These components ground our practice every day. All are relevant when helping clients work through their stress or mental health issues. Specifically though, let's focus on accepting a non-judgmental practice, as well as compassion and empathy. Why are these important for reducing stigma? In part, it gives us a chance to check our own biases. It also helps us recognize when a client is being vulnerable and meeting that vulnerability with acceptance, even if we think we know better. From our coaching workbook, your client should be comfortable talking to you. You are there to listen without any judgment. See the client situation from the client's view, knowing that change is difficult and ongoing. Regardless of a client's journey and what you think about their choices, recognize that they are trying their best to improve their health and their life. You might not truly understand where they're coming from, but you can be supportive along the way. Keep learning about coaching, stress, and emotional wellness by completing our other activities.